Greetings. This is Justin Allen with the Elite Nurse Practitioner. This is the Telemedicine Practice course. This course is going to teach you how to open up a telemedicine practice. We are entering a new era in our healthcare system. This COVID pandemic has opened the eyes to the general public. They are realizing that they do not have to go to a clinic anymore to seek medical care. They can utilize telemedicine platforms. Telemedicine right now is blowing up. Let's go ahead and get started and get a telemedicine practice started as soon as possible. So why telemedicine? It's a growing field. Obviously, the COVID-19 pandemic is changing the face of telemedicine as we speak. People are realizing that they don't have to go sit in a waiting room. They don't have to sit there in an exam room for 30, 45 minutes waiting for a medical provider to see them. They can just log in, do a video chat or even a phone call with someone, get their prescription and go about their life. People are looking for convenience. That's what they are looking for. So you are here to deliver them that convenience and you will be rewarded handsomely. Another good thing about telemedicine is that you can target a huge market. So when you open up a regular practice on a corner of some street, your target market, your demographics that you're targeting are only people within, a 50-mile radius, if that. So when you start a telemedicine practice, you can target a huge amount of people. I'm talking about the entire state you are licensed in. We're talking about millions of people here. And if you get other licenses in other states, you're talking about tens of millions of people. Now, it can be cash, it can be insurance. I believe cash is the simpler way to go. Cash is king. Cash makes practice so much easier. I cannot stress that anymore. When you accept cash in your practice, you can do what you want. You don't have to follow insurance, Medicaid, and Medicare guidelines. You can do as you wish as long as you're following state regulation and following the rules of the DEA and that kind of thing. You don't have to follow the rules of Medicare or Medicaid. You can kind of do what you want. The overhead is nothing compared to a brick and mortar practice. The overhead with a telemedicine practice is nothing. My telemedicine practice, the overhead on it is literally probably $400 a month, if that. The biggest expense is marketing it. But this is the great thing about telemedicine. You don't need office. You don't need utilities. You don't need office furniture. You don't need staff. You don't need any of that stuff. You can do this by yourself. It's very easy to start. All you literally need is a phone, internet, and a computer. It's all you need. You don't need anything else. And yeah, it's a high revenue, low expense practice. What does this mean? Significant profits. So what is telemedicine? Telemedicine is defined as the distribution of health-related services and information via electronic means and telecommunication technologies. What does that mean? It basically means that you are providing medical care via video or phone technologies. That's basically all that means. There's multiple names for it. E-health, telehealth, telemedicine, doesn't matter. They mean all the same thing. There's no difference between them. So what are the pros and cons of telemedicine? So there are some main pros here listed. So the biggest thing is it improves patient access to care. You can talk to anybody throughout your entire state. All they have to do is have an internet connection, and most people have internet these days. So you can access someone who lives 200 miles away from you that lives in some podunk little town. You're targeting a large population of patients. Like I said, you're targeting the entire state versus just your local region. This means that you can make a lot of money very quickly, very easily, very cheaply. It's the convenience. The patients want convenience. We live in a day and age where people want things now. They don't want to wait. They don't want to sit in a waiting room for 2 or 3 hours. The cost savings. People aren't having to go and drive to a clinic. They're not having to waste their money on gas. Those kinds of things. It's more efficient. It really is. All you gotta do is log on your computer, load up a program, load up a website, and you talk. It's literally it. It's very simple. And it's generally a low liability practice that completely matters on the service you're providing. So the cons, like I said, limited physical examination. You can't listen to lungs with telemedicine. You need to be aware of the limitations that telemedicine has. It's very difficult to look into an ear unless the patient has some sort of specialized device to where they can look in the ear. It's not cost effective. It does increase your liability for certain services. And like I said before, it's basically based off of you can't do a physical examination on someone. Therefore, if the diagnosis mattered on the exam that you were going to do, it increases your liability. Because if you misdiagnose someone for, let's say, just bronchitis and you give them an inhaler and they actually had pneumonia, it increases your liability. So again, know the limitations. Technical problems. Technical problems do occur. Sometimes the internet for the patient's extremely slow. Sometimes the video crashes. Technical problems do happen. Insurance reimbursement and regulatory barriers. Insurance generally does reimburse for telemedicine services, but some insurances don't. Medicare is a pain in the rear to get reimbursement for, so there are those. There's definitely state regulatory barriers too. Some states have some restrictions in place for telemedicine, so we'll go over those in detail a little bit later. There are two types of telemedicine visits. There's synchronous visits and asynchronous visits. Synchronous is live communication. It's real-time interaction between two parties utilizing audio and or visual technologies. It mimics a true medical visit. You're talking to the patient in real time and you're interacting with them. That is what most people will be doing, synchronous telemedicine visits. Asynchronous medical visits are visits that are done on like a store and forward communication platform, done at separate times. So basically what happens is the patient will record a video or an audio, or they'll write an email, and then they'll send it to the medical provider. And then the medical provider will review the information 6 hours later or 3 or 4 days later or whatever it is, and then communicate with the patient again through another email or a phone call or whatever and address their needs. So asynchronous visits aren't used as much, but they're great for like prescription refills, simple complaints, those types of things. They generally require you to have an established relationship with the patient, because how are you going to trust some random email done through your site about a guy who wants a refill on his lisinopril or something? It really does require an established relationship with the patient. So we're going to focus mostly on synchronous visits during this presentation, as asynchronous visits aren't that widely used. There are liability issues with it and that kind of thing. Y'all take care. God bless.